Isn't that grand? Look who's here in studio. Just when I was feeling sick, Doc. Man, about these.
This is Dr. Kevin Schmidt. He's the head
Hi,
of
Kevin. Nice to meet you.
ER doctor. He's head of the disaster preparedness over at San Joaquin.
San Joaquin.
And what I wanted to do for the first 10 minutes, then we're going to talk about women's hormones, by the way, after the rest, and testosterone for women, which will be interesting.
Okay.
But the first segment, I want to talk about the flu, because I want to tell you a story. What happened this morning? All right, but I had a guy come in this morning, and he epitomizes what 99.9% of the people out there asked him, "Do you want a flu shot?" And he said, "No, I never get the flu. Blah blah. Forget about me." And I explained to him, "Holder, you're making a mistake, because most people don't realize. You see, last year, 36,000 people died of the flu. In fact, I had one of my own patients who had lung disease, who got the flu, didn't get immunized, got the flu, and bottom line, she died. Wow. 36, all right?
Jeez.
Now, she had terrible immune system issues and all that kind of stuff, and we understand that. She's one of those 36,000. But here's what people don't understand. You see, when you tell me you won't get the flu, I don't get the flu, that's really a lie. You will get, who's exposed, if it has no immunization for it, you will get the flu. Now, you will probably get an attenuated version. You may not even notice you got the flu. A few aches and you have a little runny nose, and who cares? And you fluff it off, and it doesn't bother you. But here's where we're making a problem with society, Jazz. Let's say that you are that person. You've got the flu, but you don't know it. You're going to walk around for 3 weeks shedding virus. All right? Every time you cough, you're blowing it all over.
You did say shedding.
Shedding.
Okay.
It's essentially,
you said something else. But,
but essentially, bottom line, all you have to do is walk by some other person who is, elderly, or is a diabetic, or has some other immune system issue,
problem, sure.
and you cough, and they get that virus, you just sentence them to death. We are looking at the flu shot as sort of preventing me from getting the flu, and it's really, we're trying to prevent the flu from affecting all these people and killing these people.
That's a great point.
It's a social responsibility to do this. It's not my job I'm not going to get it, screw the other guy. And this is what people don't understand, Jazz. If we take it and look, the flu shot is safe. It no longer has mercury, thimerosal, all this kind of stuff. There's very few people. In fact, we have flu shot now that doesn't even have eggs, and if you have egg allergy, so all this idea about the flu causing, a lot of illness is not really up to date. But the flu, if I don't take it, and I don't get the flu, but I get this attenuated version, and I'm coughing, do you want to end up responsible for coughing in some old granny's, that's going to die because of it? See, that's where we're missing as society. There's a public responsibility. I want to ask you this. If you had polio, all right, or let's say whooping cough. Let's say you got whooping cough. Would you, attenuated version, would you be walking out there giving it to everybody else? No. You see, and that's the way we have to look at the flu shot. What I thought, I'd have Dr. Schmidt, all right? He's an ER physician, one of the big ER doctors over at San Joaquin. He sits and chairs the disaster relief for the county and for San Joaquin. I just wanted to bring him on because there's some things about what happens with flu and what you shouldn't be doing to do it. All right, Kevin, why don't you talk?
First of all, I wanted to say thanks to Jazz and Dr. Mensah for having me on today. I was actually, I have to say, Jazz, I was listening to you on the way in, and I wasn't expecting Jazz. I was expecting a Taz. Boy, you were really fired up there.
No need to talk about the flu to get me down from talking about PC college campuses.
Unfortunately, I didn't bring all my Ativan and stuff with me. Otherwise, I could have treated you here. But anyways, the thing that got us going on this is that in 2009, we had the swine flu scare in town. And basically what this was, in retrospect, it was mass hysteria. It was created by the media. And in fact, at the time, if you got the actual H1N1 swine flu at that time, that you didn't have as bad a symptoms as a typical flu. But the emergency rooms were flooded. They had the CDC putting up tents in the parking lots. This was just insane.
Sure, well, we had a tent at San Joaquin.
I remember this. We had to take the wife to the emergency room for something. It had nothing to do with having the flu, and she coughed once, and all of a sudden it was like the It was like the Red Sea parted. Everybody got out of our way.
Yes. I was going to say that's one way to get, I guess, seen quickly, right? Would not recommended. So we wanted to talk a little bit about trying to prevent people from coming to the emergency room. And the first way you can do that is please get the vaccination. As Jan had just said, that the biggest thing you can do is even for society is to get a vaccine so you're not spreading this around. For me personally, I got it in 1990 when I was a surgical resident, and then I've had the vaccine every year since then. Well, I'll tell you, when I got it, I couldn't stand up. I felt like I was being beat up. Every year I've gotten it after that, I've never had any symptoms.
How long did it last?
Oh, it was several days, but I mean, I literally couldn't stand up.
I don't know, but because I've had colds before, and I've had things that were worse than colds, but they were all gone in a day or two. And the only time I ever felt like I was knocked out, and I didn't go to the doctor. I just didn't have any insurance, didn't have any money, just didn't do it. I was working in a nightclub as a DJ on an independent contractorship with the club. And I ended up being out of work for about 5 nights, and I was on my back the whole time, and I think it was pneumonia. But it was pretty bad. I don't know if it was the flu or not, but that was many, 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 many years ago. And if it's anything like that, no, I never want to go through that again.
Yeah, and so why should you have to? If you just get vaccinated, we can try and prevent this. Now, of course, it can get worse. It could have been a pneumonia, but let's try and get ahead of this thing so you don't end up like that.
Yeah.
Well, that comes back to what I said. This, to a certain extent, there's a social responsibility to look at this and say, I want to prevent some other old guy or whatever, whoever that person is.
A little kid.
It could be a little kid that's got leukemia and has got a poor immune system or something else that you could be by coughing or touching some surface that they're going to touch, sentencing that person to die. And that's where we don't think of it. We're always thinking, I don't get the flu, forget it, I don't need a flu shot. But that vector, that area of flu is still running around. Why we have no polio today is because there's no polio virus going around.
Right, exactly.
And that's essentially how we want to look at the flu. And it's not a popular way to look at it. I want to be frank with it. But it's a way that if we're going to get control of it and not have 30, 40,000 people die every year, this is what's going to happen. And number two, the bigger issue to me is if we can get control of the flu. He mentioned H1N1, and there are other serotypes that are going to come up that are going to be disastrous. I mean, if you think of World War I, what stopped World War I was that the Germans got the flu 2 weeks before the Allies did, all right? And literally wiped out the German troops, and they sued for peace. A lot of people don't know that. But what happens, they had a mortality of something like 35% at that time in areas in the trenches from the flu. If we get another flu virus, a real bad one, and we don't have this reserve of a lot of population that has been immunized, it can be disastrous. And that's where it's going to happen. Now, Kevin, would you recommend they go to the ER if they get the flu?
No, absolutely not. I'm actually glad that you brought that up, because if you have the flu, you're going to give it to somebody. If you don't have the flu, you're going to get it. And the bottom line is there's really not much we can do for you anyways. There's simple things that you can do. Wash your hands. Don't cough on people. Take some ibuprofen or some Tylenol if you do get a fever and the body aches. Drink plenty of fluids. Try to avoid sick people. Wash your hands frequently. And then if you do get into the emergency room, like I say, you run the chance of giving it or getting it, and there's really not much we can do for you anyways.
Well, that's interesting. Most people who come to the ER is after 72 hours. What's important about that?
It's significant because in order to have any benefit of all, you have to start the medication within the first 48 hours.
Yeah, and nobody's sick enough to get it.
Yeah, exactly. So by the time you got there, it's not
going
to work.
It's too late.
Yeah.
All right? People don't understand that.
It's not like the scratchy throat and you take the airborne or any of those other medications.
Those things are not bad to do.
But when you get the scratchy throat, that's 2 days before you're going to get the full-bore cold, usually for me anyway.
Right.
And I overdose on vitamin C or some of those other zinc and things like that. And usually it's very mild, and then I just, taper maybe just 0.5% less than I would be normally, and then I'm fine after 2 days.
The other thing what we recommend, we do in the practice, we're very aggressive with D3 replacement, but essentially, if go to your doctor, get them to check your D3 level, and make your D3 level between 80 and 100. If your D3 level is above 80, literally your immune system is up here, and you will have minimal symptomatology. It's amazing.
Yeah.
3 years ago, January to January, essentially, we checked all D3 level. Well, that was before we were being aggressive with D3 replacement. And January, a year later when we had 11% more patients, Jazz. We had 39% fewer visits the next year because of it, with upper respiratory infection. It is amazing what can happen. There's amazing literature with this stuff. But you have to have D3 level that's 80 or above.
Vitamin D3, 80 or above.
Your doctor
and you can do this through any blood test.
Yeah, your doctor will do it for you. But it takes aggressive replacement to do that. But if you do that, amazing things happen. Literally, I went to a conference this was about 2 years ago about D3 replacement. And, they tell you that it's good for skin cancers and all this kind of, and it's what's called apoptotic. Literally decreases the risk of skin cancer if it's 80 or above. And I kind of made a mistake with this guy, but I had a guy probably about 6 months, 5.5 months, 6 months ago, came in and he had a congenital defect, all right? That essentially he has a gene defect and he gets skin cancers all over his body.
Oh, geez.
And he came to me on his legs covered with preactinic keratoses. These are early squamous cell carcinomas. This guy is 51 or 52, and he's had over 100 biopsies. I mean, you can't cut them all off, all right? And he came to see me, and I mean, all we do, and we bring him in every 6 months, and we essentially strip him naked and look and take the worst ones off. That's literally what happens. And I was telling him, I said, listen, we need to do your vitamin D3 levels, all right? Because there's very good literature about D3 and levels high, above 80, and limiting the access of skin cancer. And he said, okay. And he came back, his D3 levels were 8, which is just disastrous low. And we replaced his D3. And I made a mistake, Jazz. My mistake was I should have taken a picture beforehand. His legs are just covered with thousands of these skin cancers. And taken a picture beforehand and after. And I did. Right? But anyhow, 6 weeks later, he comes into the office. He is ecstatic. In fact, he drops his shorts and his pants almost to the floor. I walk in. It's almost inappropriate. So what's going on here? 80% of his skin cancer lesions are gone. He'd never seen anything like it.
Amazing.
It's amazing. But there's a lot. Keeping the immune system is very important to that.
No,
but you got to get the flu shot, because if you don't, you have the potential to spread it to someone else, and you may sentence that someone else to death. Think of the practice like a doctor from 50 years ago. No long waits for appointments. 40% of our appointments are seen same day. No rushed appointments, and access to a phenomenal amount of discounts. We have the time to do good medicine. We're also focused on the emotional, the spiritual, dietary. All of those things feed in. We do more than most urgent cares do, because we have the expertise, the skills, and the equipment to do it. We're able to do that top quality medicine, have that phenomenal access for less than a cup of coffee a day.
I joined the practice for a number of reasons. One, I knew Jan Mensing for many years. He's a superb doctor, and I have appreciated his expertise in other areas. It's very affordable. Medications, he's worked out deals with pharmacies. One medication I get for free, it would cost me $300. What I like best about the practice is the availability, accessibility. At times I'm able to get in 2 or 3 hours. They deeply care about their patients here in an extraordinary way, which is unusual in today's modern medicine in most places.
My husband and I joined the practice 3 years ago. We could not afford medical care at the time. Not long after we joined, my husband had a spider bite, and he got very ill within a day. I was terrified that we were going to have to put him in the hospital, which I knew we're looking at $40,000, $50,000. We brought him in, and Dr. Mensing saved his life. We were able to come in here every day without any extra charges. I love Dr. Mensing. He's wonderful, and I will never, ever forget how Dr. Mensing was with us.
My family and I have been members of the practice for the past 2 years. I joined the practice because I wanted to find a place where my family could be treated without taking a lot of time. But what we like about the practice is that if our kids are sick or we're sick, we need medical attention, they'll take us usually the same day. They treat you very well. It's not very expensive. It's affordable. I like that the practice is always there for us. Nos unimos con The Practice para que nuestra familia tenga muy buenos, eficaces doctores. Nos gusta mucho porque si uno de mis hijos está enfermo, nos meten de forma inmediata, por lo general el mismo día.
Lo que más me gusta de Practice es que hablan mi idioma.
Es un plan muy económico y que atienden a uno muy bien. Lo que más me gusta de The Practice es que siempre están ahí para mi familia.
Cuando llegué a la oficina y vi al doctor Messi, yo llegué y me sentía débil, muy débil. Yo había visto muchos doctores y no me arreglaban el problema. Pero cuando llegué aquí al doctor Messi, él me hizo un chequeo, un examen completo y encontró el problema y me ayudó, me dio el tratamiento que necesitaba y ahora me siento con mucha energía y estoy muy contento aquí. Él es un excelente doctor, estoy seguro que les dará ayuda tal como lo hizo conmigo.